would like to thank you to Dr. Rami and to the NGO Lost for the invitation. We are very, very happy about that. Very shortly, I'm Andrea Isenegger from Switzerland. My background is pharmacist in public health, and I'm the project coordinator here in Bekaa Valley for Medecins Sans Frontières. So I will shortly present you the organization in the next 10-15 minutes. And hopefully after we are having very, very interesting discussions with Dr. Sukkari about health and their responsibilities. I will show you now a very, very short movie of about 1 minute concerning MSF in general, Medecins Sans Frontières in general.
ثمة منظمة هدفها مساعدة كل محتاج بغض النظر عن الجنس أو العرق أو الدين أو العقيدة أو الانتماء السياسي أو حتى حدود البلدان. في العام 1971 قررت مجموعة من الأطباء والصحفيين تأسيس منظمة أطباء بلا حدود، منظمة مستقلة تماماً 92% من مصادر تمويلها تأتي من أفراد مثلي ومثلك، وهي منظمة تلتزم بأخلاقيات المهنة الطبية بالنزاهة والحيادية وتسعى إلى رفع الأزمات المنسية للرأي العام. اليوم منظمة أطباء بلا حدود تلتزم بتقديم الرعاية الطبية في أكثر من 70 دولة حول العالم، وعدد موظفيها يتجاوز 35,000 موظف، من بينهم أطباء وأخصائيون وطاقم طبي مساعد ومختصون باللوجستية والهندسة والموارد البشرية والمحاسبة وغيرها. لمزيد من المعلومات زوروا موقعنا.
In the 19th, MSF supported families affected by the trauma of the war and the ongoing Israeli occupation. During 2006, during the Israel war, MSF activated an emergency response to provide supplies and essential medical aid for the vulnerable communities in Lebanon. In 2008, MSF began a 3-year mental health program for the Lebanese and Palestinian in the southern suburb of Beirut. In 2011, finally the response to the Syrian crisis started, and MSF has donated emergency supplies to health centers near to the border of Syria. Then, between 2012 and 2016, the influx of refugees increased, and MSF has been continuously expanding its medical response mainly in the Bekaa Valley, so Bekaa Valley and Tripoli. Including socially vulnerable Lebanese returnees from Syria, and Palestinian refugees from Syria. All these groups were received the medical care from MSF, or are still receiving medical care from MSF. Here you can see very well where we are active in the country. So you see that MSF is mainly very spread in Bekaa Valley, as well as in the northern part of Lebanon, such as Tripoli and Akkar. So the 3 projects in Bekaa Valley. I would like to focus in Bekaa Valley because the topic today is about the region here, right? First of all, the primary health care and maternities, where I am the project coordinator. In Bar Elias Hospital, we are having a chronic wound management and elective surgeries. The opening of this hospital was just recently. They opened the hospital on the 19th of November, the inpatients ward, and the outpatients ward was opened at the beginning of November. Then in Sachle, pediatric hospitalization services in the governmental hospitals. Let's go to very shortly to statistics. I'm not going through all the figures, but I would like to highlight maybe 2 lines. The number of PHC consultations. So you see in the whole country, in the year 2017, it was nearly 370,000, and in Bekaa Valley was a bit more than 110,000. The number of chronic diseases in the whole country 2017 was a bit more than 100,000. And in Bekaa Valley, the same year was 47,000 and something. And here I even have the figures already from January till middle of November, which is nearly 40,000. So now we are coming to our real activities in Bekaa Valley. We are having 4 clinics in Baalbeck, in Hermel, in Majda Anjar and in Arsal. In Majda Anjar and in Arsal we are having maternities as well. In Hermel and in Arsal we are providing acute pediatric care or activities. Otherwise, in all other clinics, we are providing non-communicable disease care, medication, mental health, sexual reproductive health, and health promotion. I would like to present you very shortly the active NCD, non-communicable disease cohort. The non-communicable disease medication, it's one of our most crucial activity here in Bekaa Valley. So you see that the figures in 2018 from January till middle of November, we are having an active cohort of more than 5,300 patients. So the biggest cohort is in Arsal with more than 2,000, following to Majda, then after Baalbeck and Hermel. The number of all the non-communicable disease consultations in the clinics are more than 37,000 already this year. You see it's Arsal on the top, then after following to Baalbeck, Hermel and Majda. Arsal, Majda, and then Baalbeck and Hermel. The morbidity in the cohort, very shortly, what is very interesting, especially for medical people, you can see that the most is the hypertension, following with diabetes mellitus, it's a type number 2. Of course, in order to implement and in order to have such big project like we are having here in Bekaa Valley, we need very good collaboration. So we are having collaboration with the Ministry of Health, with IMCA, with UNHCR of course, other local and international NGOs. I'm speaking about ICRC, Médecins du Monde, Humedica, and of course LOST. Now I would like to present you 3 last slides concerning the challenges which we are facing here while working in Bekaa Valley for our patients. So of course, one of the biggest challenge is access to health. What we are realizing is that there are not enough ambulance services, especially what we are realizing, maybe there are enough cars but not enough HR. There are not enough of non-communicable medications in the valley. You know, there are usually long life treatments, so it's very important not to interrupt them, so it's quite challenging for us. Furthermore, it's very important that some of these medications are very sensitive and they need a cold chain. And it's not always the case. Of course, here it's very challenging as well because there's a lot of electrical cuts. So for cold chain, it's very difficult. And there are very few affordable options for health care in the northern part of Bekaa. Finally, here in Bekaa Valley is very difficult, the climate. There are very hot summer and cold winters, which can easily impact the health of the population. Then I would like to show you a bit the challenges for the Syrian refugees. You know that the main cohort of our patients are Syrian refugees. So the Syrians are not always very accepted in all the health facilities here in the Bekaa Valley. The transportation costs are very expensive. For example, from the camp Mashriaka to Hermel, one person costs about 20,000 Lebanese pounds, which is really a lot of money for a Syrian refugee. On the top of that, there are some shortages of fundings to cover health, like international organizations, they reduce their fundings in the Bekaa Valley. There are still a lot of changes of SOPs, SOPs is the guidelines of the international organization. Then I don't have to mention to you, probably you know already, that the the condition of the ITPs is very, very low. Access to healthy, diverse and quality food in order to respect the adequate diet in case of non-communicable diseases is very challenging as well. For example, fruits and vegetables are very expensive. A diabetic patient should eat more brown bread than the white bread, and the brown bread is quite more expensive than the white one, and so on. And lastly, the restrictions in movement to the missing documentation, because a lot of refugees don't have the proper documentation, so it's very difficult for them to move in the region, like from one clinic to another one. Now the last slide is that I would like to show you very shortly the challenges of MSF. One of the most challenging points is the referral to hospitals. There are not enough beds for specific activities or diseases. Secondly, the distribution of Syrian refugees in Becca among rented houses, unfinished houses, tents, collective shelters and settlements. That's very challenging when we would like to do some health promotion activities or vaccinations. Then the last point is the defolder tracing. Patients are moving in and out, and that is for us very difficult because we are losing the patients, especially for long life treatments. Thank you for your attention.